You're listening to the Shelift Project podcast, a show dedicated to helping women achieve higher levels of success in the workplace. No matter where you are in your career, we want to help you grow. Now here's your host, Cynthia Kirkpatrick, a CPA, CFP, and Senior Financial Advisor at Moneta Group.
Welcome to another episode of the Shelift Project podcast. I'm Cynthia Kirkpatrick. Thanks for joining us today. And we're going to talk to Dr. Vedica Sharma, not only about your journey as a doctor, but also, as we were talking, business owner, and a lot of the things that maybe you're not taught in college and all of the schooling that you went through and things that you have to learn on your own when you come out of school, realizing you don't know everything.
Yeah.
Thanks for joining us today.
Thank you so much for having me on. So I appreciate this. I think this is going to be quite a discussion.
And what's interesting is I think for those of us who aren't in your field and we see doctor and, you know, there's a reverence for all the schooling that you go through and everything that you know, that just this, I guess we take it for granted that you come out of school and you know everything.
Right.
However, that's not the case.
Right. Yeah. We were just chatting about that. So, you know, in medical school, we spend all of our kind of adult education learning medicine. And honestly, even when you leave medical school and you go into residency and then you go into fellowship, you're basically still learning, I would say, for the first 10 to 15 years of your adult career as a physician. And I think that you're so fixated on what you're focused on or what your specialty is that you don't really kind of deviate from that. I was actually, you know, sharing with you earlier that I probably was more well-rounded when I was younger and less well-rounded now, I had more broad skill sets, if you will, because I feel one of the things that medicine does is you're very focused on whatever specialty, you know, you focus on. And so it's just interesting. It's intriguing when you sit down and you think about it like, okay, I'm a, you know, board certified intensivist and that's what I do for a living. And my job is extremely difficult. And I sit down and I think about like, how did I get here? Did I have more skills at the beginning of all of this than I do now? And it's just interesting to think about.
So intensivist.
Yeah.
For those of us who have no clue what that is or means, what is that?
So I'm an ICU physician. So, you know, I see patients and patients' families basically on their worst days. And I take care of like the sickest of the sickest that are in any hospital at any given time. So it's a very stressful job. It's something that I'm extremely passionate about. And I think it makes me me. And not everyone can do it, to be honest, because there are very, very tough days. But it's very, very fulfilling.
I'm sitting here in this chair thinking, she's talking about having to be very focused in what she knows. At the same time, I'm thinking ICU. You probably see all sorts of different cases of emergencies.
Yes, exactly. No one case is ever the same. Every single patient is different. And I think that's the thing that I enjoy about it the most, to be honest, is that it's just so inherently case to case. There's so much variation. Obviously, you know, the foundation of medicine and everything, that is kind of the same throughout, but the cases are quite complex.
So in that regard, I'm like, well, maybe before you were a liar, you have to know a lot of different things. Or you're not giving yourself enough credit.
Yeah, sure.
In that you probably have to know a lot of different things because all these cases are going to be different. You have to connect different dots.
True. But I think I encompass all of that still as medicine, you know what I mean? Different entities in medicine versus like before I could play instruments, like I had like, you know, hobbies like in terms of like track and things like that, like things that like I just don't do anymore, you know what I mean? And if someone were to ask me to do them, I don't think I could. Like I could not play the clarinet anymore. I couldn't play the piano anymore. So it's just interesting to me, like, you know, from that standpoint, yes.
I'll give you that. Okay.
Not from the standpoint of like foundations in medicine or, you know, like one size meets all and things like that. So
well, and you have 2 kids.
I do, yes.
Right?
I have 2 children under the age of 5. It's actually going to be my oldest 5th birthday here on Friday, so she's very excited. But yeah, life, it's just intriguing when you sit down and you think about, you know, basically from the age of, I don't know, probably 15 or 16, I knew that I wanted to be a physician. And I spent my whole kind of adult life like chasing that goal. And when you get to the tail end of it, where you've accomplished what it is that you want to accomplish, and it makes you just feel like so fulfilled and things like that, and you take a seat back and actually think about it, you're like, wow, I really have spent like the majority of my adult career just studying. And no, it's true.
Well, thank you. I'm glad you did.
Yeah,
for somebody who needs doctors, we want really hardworking, smart doctors.
Yeah. So you go through obviously like 4 years of undergrad, 4 years of graduate school, medical school, and then you have to do residency training, which can vary, depending upon your specialty, from like 3 to 5 years, and then you subspecialize, which is anywhere from like an additional 1 to 3 years. And so it's just interesting. It is. When you leave your training, like when you're truly an attending physician, which means you have the ability to practice on your own, you think that you probably know everything. And then when you go out and start independently practicing, you realize that you're still always going to be a lifelong learner. And I think that was something that I realized very early in my career, just because of what I do for a living. And so I just think medicine as a whole, you have to go into it knowing that you're never going to stop learning.
So 15, 16-year-old Vedica.
Yeah.
What happened, or where were you, or take me back to that where you said, I know I want to be a doctor?
Yeah. So I actually don't think it was like any one single thing. I think that I always enjoyed like math and science when I was in high school. And organically what happened is that we had family friends that were physicians. And so I would go into their clinics and shadow them. And then I realized that I just found medicine as a whole like very interesting. One of the things that I thought was the most valuable was the people that I shadowed, at least, physician-wise. They truly, sincerely just wanted to help individuals. And so I saw that, I shadowed quite a few cardiologists. I shadowed like primary care physicians. And so that was their kind of focus. And it was very easy to see, even as a person that was so young, that that's what, makes them them, and they enjoy doing it because of that. And I just thought about the possibility of making people better when they're so sick would just make me feel better as a person too, right? So, because I feel like people that say that they go into medicine just to like treat sick patients, we all do that. And the reason we do it is because we get some sort of like fulfillment from that. And so I think that I saw that very early on, and that's probably one of the reasons why I kind of went through this, long pathway, obviously, to become a physician.
So it sounds like it connected to something deep inside of you that really
definitely
ignited a value or a passion or a joy.
Right. Definitely. 100%.
And you mentioned shadowing people. I mean, so I think oftentimes some people are afraid to ask people for a coffee or for help or guidance or mentorship or whatever. I mean, was that something that you did at 15 or 16, or were you in college? I mean, the thought of a young kid reaching out to an adult who's clearly established in their career to say, hey, can I go shadow you?
Yeah. And that's just who I've been probably since like, I was probably a teenager. Like, I never hesitate to ask for help. I feel like if there's something I don't know, I'm very honest about the fact that I don't know even with my patient population, like when they come in so acutely ill, I actually will tell family members that I don't know what's wrong right now, but I will figure it out. And I think that there's a lot to be said about that level of honesty, because when you walk into a room saying that I know exactly what's happened and this is what we're going to do and that, it's great for the patients and their families because they know what the next steps are. But what if you're not right? What if you are wrong? Then like they get tunnel vision and they're like, well, this is not what I thought it was going to be. And then, it leads to a whole slew of other problems.
What do you do in your role as a doctor when you are, I'm not sure. Where do you go from there?
Yeah.
I mean, because a doctor oh my gosh, they're supposed to know everything, right?
Yeah. And I will inherently tell you that doctors don't know everything. So, I mean, I think there's a lot of us out there that, act like they know absolutely everything about everything. And I just don't think that that's true. I think that when you don't know, if you're honest about that, and then you go and you read up on it, or you try to figure out what the differential diagnosis, which means like, hey, it could be like this, and you think about it and you go down kind of based off of what you find in the patient's labs and things like that and testing. So you figure it out. My job as a whole, because of what I do, I literally have to figure it out. So, I just find that it's like putting together pieces of a puzzle. You have certain parts, but you don't have everything together.
Yeah, I mean, all the different books and knowledge out there now always talks about whether you're a leader, whether you're still learning. I guess leaders should always still be learning, right?
Right, definitely.
That you're never going to know everything. And the really smart people are the ones who are willing to admit, are honest. I don't know this.
Yeah.
And I'm willing to find out.
Right.
And whether it's doing the research or bringing in other people to help you find out, or never being the smartest person in the room because I need those other people in my bench, in my group, to help fill in the areas that either I don't want to do or I know I'm not an expert in, because I want to elevate the whole.
Yeah, exactly. And like I said, because we deal with so much, I deal with so much life and death and uncertainty in my patient population. You have to be okay with admitting when you don't know, sincerely, because there's just, like I said, I see patients when they're at their worst. Nobody comes to the ICU just to hang out and meet me. And so, so I have to also acknowledge, which I always try to do, that I'm meeting this individual or that patient and the patient's family at that time in their life, when they probably, to be honest, don't want to meet me, right? They want me to figure out what's going on, but they don't necessarily want to be there, and nobody can blame them for that. So.
Yeah, it's funny. I when I talk with my clients, I'm kind of like, we set our next meeting 6 months from now. And I'm like, at least you probably want to see me, not like necessarily the dentist or whoever.
Yes, so, exactly.
As you said, they probably don't really want to see you.
Yeah.
And what you're seeing are very emergency, not fun cases.
Not fun cases, correct.
So why? What is it in you? Or why choose the ICU of all the things
that I could have done in medicine as a whole? So initially I thought for the longest time that I wanted to be a surgeon, which, I mean, there's parts of surgery that you can also do ICU medicine. But then when I rotated in medical school through and basically did my intensive care unit rotation, I realized I actually had this patient that probably, like 9 years since that story now, but her and her family just thanked me and gave me a hug, because she came in, on life support, on very high dose medications to support her body while she was getting better. And we were able to get her kind of on the opposite side, where she's off of the ventilator, the blood pressure medicines have worked, we figured out what the cause is, and she left the ICU. And her family and just her, obviously as was she, just so grateful. And I think stories like that, where they're just so genuine and just grateful for you just being there and helping them get through this terrible time in their life. When we can turn patients around like that, I think that that's probably the reason why I do what I do. So, because it's hard. It is very hard.
Are there, I think of one of my shows that I've loved. It was House.
Yeah.
So when you're sitting here, I think of those crazy cases where, I mean, were there things that you saw that were just out of this world?
Out of this world, and obviously I can't discuss some of them, but yeah, I think. Have you seen that new show? I think it's called The Pit, maybe.
I haven't.
But my real life is very much like that. Obviously, it's a show that's focused on ER, but a lot of the things that they do in that ER are actually like ICU medicine. And so I'm very grateful for having the ability to do this, and take care of people. Because, like I said, not everyone can do it, and it does emotionally definitely take a toll sometimes.
Any other stories that you can share or
Yeah.
high level share that stick out to you?
I've had some really bad cases recently, so those are the only ones I can remember right now. But the ones, like I said, that we're able to get the patient before they're where we're able to get them to turn around and things like that. They're on life support. They're on a lot of blood pressure medication. They have some sort of infectious process or something that's reversible. And we basically support their body with modern medicine so that we give their body time to heal. And then eventually we start to just make patients better. And I had a young patient recently that had very, very bad pancreatitis. And pancreatitis it can get very severe. So it's inflammation of the pancreas. It means that, your body, obviously that organ in itself kind of swells up in a way. And what happens is that you get very, very, very sick. There's a lot of reasons why you can have that diagnosis. But, we ended up having to put him on life support and support his body as it was recovering. And we were basically able to get him on the opposite side to where no longer on life support, about to leave the ICU, and just a lot better. And people like that, where you're basically at one point on the opposite side of the spectrum where you're hanging on basically by a thread, and to see them recover and come back and say, you know what, thank you for doing that. You've saved my life. And it's just very fulfilling, like I said.
And I imagine with stories like this on both sides of that spectrum,
right,
it's very heavy for you and the people that work in the ICU.
It is. I mean, and not every day is like that, obviously, but there are definitely cases that are still in the back of my mind where I've had very difficult situations or patients that didn't make it, that stay with you, if you will. And you don't ever probably let go of, things like that. So
how do you work through that, deal with that?
Yeah.
Whether it's, help through the hospital system,
right,
or getting help outside, whether it's getting help or, they talk a lot about self-care.
Yeah.
What do you do to recover or whatever you go through?
So, as soon as, like I shared, I have 2 young children. Actually, my youngest is only 7 months old. And so as soon as I leave the hospital and I enter the door of my house, to be honest, everything, not everything, because there's certain things that I said, I can't forget. But it's just, I don't know how I would be able to cope with some of the things that I've seen if I didn't have my kids, because just seeing how they are and just the love and the care and the joy, it just helps kind of overcome a lot of the other things that I've seen. You know what I mean? So
yeah, especially that young.
Yeah,
you're just
that
so
young.
pure.
You're just so pure, and you're just just grateful for everything. Yeah,
it's interesting being a mom also. My kids are a little bit older, but I do love the joy when they're young. But it hit me. Your oldest is 5.
Mm-hmm.
It's 2025. Mm-hmm. If we rewind.
Correct.
COVID.
Yeah.
You're a doctor.
Yeah.
ICU, and you have a baby.
Yeah.
Holy cow.
Yeah, it was holy cow. That's right.
What must that, how was that? What must that have been like?
Yeah. So I had been told by my mentors, that had lived through and trained through really bad seasons with influenza and things like that. And I had my oldest 6 weeks into training, fellowship training for ICU. So that training pathway is usually 2 years. So I started ICU training as COVID was ramping up.
And we really, today, we know this thing is COVID.
Correct.
But back then,
we didn't.
At the beginning of 2020, it was like, this thing over across the world.
Exactly.
It's not going to come here.
Yeah,
it's not that big of a deal.
Yeah, exactly. And because of the fact that we didn't really know what it was, we didn't really, I mean, I spent part of my training, we were basically changing the algorithm, if you will, on how to treat COVID patients, because that's what happens when you have an outbreak of some sort. You learn as you treat actual patients. And so I spent a lot of my training treating COVID patients. And that was probably one of the most heartbreaking things to see. We had families that couldn't say goodbye to their loved ones because they were immunocompromised. We would try to get them on an iPad of some sort. And sometimes we were successful, but sometimes that patient unfortunately passed away before we could. And when you think about that, when you think about the fundamental problem, one of the huge fundamental problems with COVID was that there's so many instances, if you talk to individuals, where they didn't even get to say goodbye to their loved ones. It's just horrifying when you think about it, Yeah,
because today we can sit here, and many of us do, right? And we think back and we're like, well, why didn't we do this? Why didn't we do that? We can, that rear view mirror, diagnose what we should or shouldn't have done. We literally knew so little. And I think, tried to do our best in protecting people and shutting things down. Maybe things were overdone, maybe they weren't.
Right.
It just was so unknown in how this was taking over, especially those who were very susceptible to how it was affecting the body.
Definitely. I mean, we had patients that obviously were immunocompromised if they were going through chemotherapy, radiation therapy, and they were fine, as they were undergoing treatment. But unfortunately, someone in the family got sick. And before we really knew how easy it was to get COVID, people were giving it to their loved ones. So we would actually see a surge, basically, after any major holiday, July 4th, Christmas, Thanksgiving, and you could see actually, because we were tracking the total numbers of COVID patients, because we needed to, obviously, just so that we can also figure out, are we still going up in total numbers, or are we finally on the tail end where we can say that, people are getting better? And it was always after a major holiday. And it just proves that, everyone knew probably at that point in time that patients could get COVID and you could give it to your loved ones and things like that. But I think people need human interaction. And I think that's what I learned during COVID, to be honest.
Well, and you're obviously still learning in
100%.
Your long
yes.
physician education process.
Correct.
And you have a child at home. So, I remember hearing from people in our circles who were doctors of having to change outside in the garage. And,
So, that's what I did. I didn't know enough about COVID at that point in time to feel comfortable basically just coming into the home and things like that. So I would change my clothes at work. And then as soon as I got home, I would go home and basically shower right away. And there was probably a 6 to 8 week period, even though I had just had my oldest, whose name is Palomi, where I didn't know if I could hold her. And I was, a new mom. Just think about the level of devastation that, probably kind of leads to for an individual. And so, when I think about it now, obviously I have my 7-month-old, and I actually did recently compare, wow, this compared to what I went with Palomi is just completely different. So
the first time mom plus all the first time body hormonal changes plus
exactly
the issues you're going through at work, not only in a normal instance where you're doing all the ICU stuff, but then throw this global new pandemic, once in 100 years pandemic on top of it.
Right.
Oh my Lord.
Exactly. So it was definitely I still can't believe that, I went and trained. I was training literally when we had a pandemic. because training in a pandemic is like training on steroids, basically, because you just have to always, you never know what's going to happen.
I mean, looking back, what did you learn or what got you through all that?
I think it was probably still my hope that we were going to get through this pandemic. I will say that near probably the middle, where you see so much negativity and so much death, it was hard even for me, who's an overall positive person, to kind of remember that we probably can get through it as human beings. And I think once again, I had a lot of my training program. I trained over at Mercy, and we had a lot of support. Our attendings understood, all the fellows used to talk to each other. So there's a lot to be said about supporting one another through something like that as well. And I think overall our program did that very well. So,
and I think that transcends, obviously, especially what you do, but with, what people are doing in business and life, whether you're building your business, you're building your career, or you're going through something difficult, to surround yourself with that network.
Yeah, definitely. Definitely, for sure.
You can support each other. Yep. You can tell people what you're really going through.
Yeah.
And if it's in positive times, it's building each other up, elevating each other up,
right,
in business or in life.
I would say everyone deals with loss and grief in a different way, right? Some people need to talk about it with their loved ones. And I had a lot of colleagues like that would go home and share, some stories that they've experienced at work and things like that. But for me, I needed to basically just go home and spend time with my family and then go back to work the next day. And I think every single one of us, if you were to ask 10 ICU physicians, they would all give you a different answer about how they dealt with COVID, how they dealt with grief, and seeing so much loss.
So for those of us on the outside, again, having this vision, not only of doctors, but I think whether it's through TV or just having been in, what is it about the ICU that we may not know on the outside that would be interesting to know from the inside?
Well, like I said, I don't think that any patient encounter or any patient that comes through the ICU doors is same in any way to another patient that's there. I think that people also do fundamentally probably not realize that, yes, their loved one is obviously in the ICU, but as ICU physicians and ICU nurses, we not only are supporting the patients, but we're also supporting the families. We make sure that they're aware of everything that's going on. And like I said, we try to be honest about where they are in their kind of path to recovery, and if recovery is even an option. You do have to be honest about if there are certain instances where it's just that's not going to happen. Because you want to set expectations that are sincere and honest with patients' families.
So what I'm hearing is something we talked about before we started hitting record.
Yeah.
Is that your skill set ends up going way beyond the med school diagnostic.
Yeah, I think so. And I think that ICU physicians that enjoy, doing what they do, I think that does come across, because you really do have to be multifaceted, if you will, when you're providing any sort of patient care.
And I think those of us who, are sitting in the seat or on the bed or
sure,
whatever you want to call it, can feel that difference of interest versus,
right,
bring them in, bring them out.
Bring them in, bring them out. Yeah, exactly.
I don't know if that's the right wording, but that's
definitely
what came to mind.
Yeah.
Especially whether it's yourself or if you've got, your child in that seat, and
right,
especially as the mother.
The one thing I'm grateful for, which, there's pediatricians and they're great at what they do, but I only take care of adults. I actually don't think that I could take care of sick children, which is funny because pediatricians that I have that are friends will always tell me that, kids they're resilient. They will get better. And I'll be like, nope, I can't deal with that.
What is it that
I don't know. I honestly, to this day, I've thought about that because I've been asked that question before. And I really don't know what it is. I think it's just, I really can't deal with sick kids very well. Like, I just like, even though I'm a physician, if my daughter has a fever, I'm like texting her pediatrician, like, what do I do next? Because like that's literally like, you know, you become very good at what you do, but then like treating adults and treating kids, I feel like are two different entities, at least in my brain. So.
Well, here's a question. So my mom was a nurse, very much saw the same thing with her. Sometimes they say that physicians are the worst patients.
They're the worst. No. Hands down. Physicians are the worst patients. Like, you know, we will go to our primary visits, get our yearly physicals, get all this stuff recommended to us, and we will probably not do any of it, which is actually, I did hear this story. One of my friends told me that they had a cardiologist recommend to like a patient. I think it was the cardiologist that shared the story. And the patient was like, well, they were talking about weight loss and diet and things like that. And he was, you know, slightly overweight. And so the patient astutely to him said, do you follow your own advice ever? Like, you also need to, you know, walk and exercise and do dietary changes. And he's like, yeah, I get asked that all the time. So, I mean, like, there's just not, or doctors as a whole, physicians, they're just terrible patients.
And you know what? I'll give the out here because I do feel like when you do something for a living, it is very difficult to then turn around and at night or whenever also then do it for yourself.
Right, exactly.
And I will say for the most part, I think I keep our finances and everything humming. And I'll throw my husband under the bus here. If you go into our house, our picture frames have the pictures that came with the picture frames.
That's funny.
but he does like have them all on his computer. It's just getting
really hilarious
to the Walgreens or wherever different thing.
I understand that. I totally understand
He's
that.
He's so going to kill me for that. Yeah. But as I just look at him sitting there in the corner.
But no, you're absolutely right. So
there's the out. Yeah, so to all my physician friends, here's the out that I think that's true in a lot of spaces. So, you know, also, well, what's also interesting, I think we talked about with COVID. Yeah. Not only are you doing all that, you're being a new mom, still a lot of learning, and COVID happens.
Right. Yeah. Yeah.
I'm pausing and laughing here because I know that's. You also go into a new venture.
Correct. Yeah, I did. Yeah, I know. I'm crazy. I'm actually really crazy. People ask me, like, how did you do that? So near the tail end of COVID, one of the things that I saw throughout COVID was that I asked my patients, like, what, because, you know, when their friends and family couldn't come into the rooms, they couldn't see them, or like the iPad, sometimes the iPad worked, sometimes the iPad didn't work. And they all asked for more time. One thing I learned throughout my training, and because I trained during a pandemic, was that it didn't matter who you were. At the end of the day, every single individual values their time. And that was really the foundation of this company that Dr. Catherine Moretz and I created that's called Vivia Concierge. And it's been in business now for almost 3 years. So it's a company that stems on basically giving people the gift of time. We offer different types of concierge services. It's like 56 services on site and in people's homes with providers that are like vetted by us. And, you know, we try every single service before we bring it on for our members. And it's a it's the first company of its kind, to be honest, here in the Midwest. So
people wanted more time.
Yeah.
And did you two know each other?
Yes. So our husbands were actually partners as well. They both worked in the same radiology group. And so that's actually how Katie and I met each other. And then obviously formed a friendship and developed a friendship. And then one thing leads to another and used to go into business together. So.
And what are some of examples of some of these services?
Yeah, so we offer everything from like facials, massages, manis, pedis. We have wellness side of the company that does personal training. We have like house managers, which are people that will come in and do all your errands for you while you're at work or doing whatever it is that you need to be taken care of. We have cleaning services, car detailing, and then we obviously have a medical aesthetics side of the business as well and company because Katie is a board certified dermatologist. And so we provide different types of injectable treatments in patients' homes and businesses. So yeah, it's intriguing. It was really supposed to be sincerely like this very small, company that I had, we had kind of come up with the idea, and there's something to be said about being naive, right? And not really, I had no business experience. I have no business degree. I don't know anything about business. But when you don't know as much as probably as somebody with an MBA, and you're like, oh, it's fine. We'll start a company and see how things go and stuff like that. We never had a business plan. We just started literally the company from the ground up. And like I said, it's the first of its kind here in the Midwest.
Yeah, so tell me about that. I mean, you guys are just, the four of you are together at dinner or something, or,
so me and Katie came up with the idea. But yes, we did talk about it at
were you
dinner.
just like at somebody's house or something, and you're like, what's missing in this world?
Yeah.
And we should fill this gap.
So during COVID, what we realized was that people wanted to have certain services and things basically in their homes. But you couldn't find an avenue where you could find basically like a one-stop shop that had everything offered. And these people would actually show up. Because how many times, I mean, I've had my clients tell me that, they'll try to book something outside of our company because we don't offer it. And it's just not, they don't even show up. And so, we're very reliable, and that's what we needed. We needed reliability. In addition to that, people wanted just not random, folks that they don't know in their home. They wanted people that are vetted in some way, that provide all of these services. And the one thing we realized very early on, like as we were talking about it when COVID was still ongoing, that the littlest things in life make the biggest difference. Like for some of our clients that are so busy, like getting a manicure like changes their whole week. I know it sounds ridiculous, but it truly gives that individual so much happiness. And that's truly the foundation of our company and who we are, is we're just trying to like give people, like I said, the gift of time and make sure that the things that they want to get done are easily attainable.
So you don't have a business degree?
No.
Does she
Nope.
have? No.
Nope.
And
No, seriously, no roadmap, no business plan. And it's interesting. So we did this like I forget what you would call it, but this like party basically to say, hey, to our friends and family that we're going to be starting this company. This is what the company is going to do. And we had a lot of support from the beginning. So Katie and I, we have clients that have been with us for the whole 3 years. And they've seen the evolution of the company where we started off offering maybe 10, 12 things and to where we are now. And we built a company, I always tell people, on customer service and loyalty. And so that's literally the foundation of who we are, Katie and I. And even to this day, any service that any of our clients get, if it's their first time obtaining that service, someone from our company will always reach out and make sure that it met what they wanted. Is there any feedback? Do they need it customized for themselves in any way? So it's never one size fits all.
So you, as you mentioned, don't have a business degree.
Correct.
Obviously, I would think as you're going through school, your plate is full.
Yes,
thankfully.
Yes.
On learning everything about medicine that you need to learn.
Correct.
Katie doesn't have a business degree. I'm sure dermatology. Nope. She's also learning everything.
Yes, correct.
How the heck do you put these two, how do you two put it together? And do you have to pull in other people? Or?
Yeah, so we have a lot of support. So I don't think that we could have done and started a company from scratch if we didn't have like our families involved and support us and help us take care of the kids and things like that. Because otherwise you cannot do that wholeheartedly. And so I think that people don't admit enough that they need help or that they need someone to come in and assist them. And Katie and I have no problem in sharing the fact that, you know, we need help and we need it all the time. So it's okay to be honest about it.
Why do you think, well, I'm going to get in trouble for asking 2 questions at once, but I'm going to do it anyway because he can't do anything to stop me. Why do you think people have a hard time admitting or asking for help, and do women have a harder time doing that?
Yeah, I think women have a probably 10x harder time admitting that than men, to be honest. And I think the reason why is because there is this mindset out there that a stay-at-home mom should be able to do everything, and that is technically her job. And she should be able to, you know, keep the house clean, cook all the meals, and things like that. But what I think people fail to understand is that if that's truly their job, you know, and that's all they're doing 24/7, they probably are losing some part of themselves and they don't probably even realize it until it's been like 5 or 6 years. And then all this resentment builds up and things like that. And I think that women as a whole just feel like they need to be able to handle everything. But I don't think that's possible. It's just not. So, I mean, if someone can prove me wrong, let me know. But I just don't think that individuals and like moms, you know, should even like push themselves like that. You know, because then you make errors or you don't take care of yourself. And if you don't take care of yourself, how are you going to take care of your family?
No, I wholeheartedly agree. Again, whether you're I say just, it's not just.
Yeah, right.
I think there's many reasons I work.
Yeah. I tell people it is much harder to, in my opinion, you know, I'm sure people will get upset that I'm saying this, but that to be a stay-at-home mom than to go to work. And I just think that that's because you are pulled in so many directions at home. And I don't think that there's any way around that.
Yeah, I think it's, you know, the unseen work, potentially. Some things are unappreciated.
Yeah, definitely. There's always something to do. Right. So, I mean, like, always.
And I think, you know, potentially more and more things to do versus maybe long ago, just with as many more demands and technology and things that are required. And,
yeah, definitely.
Certainly it feels like the workload hasn't lessened. Sure.
Yeah, no, it definitely hasn't. And that's why when we created the company was for the modern mom or the mom. And now obviously it's evolved into this where we obviously have clients of like we take on whole families and things like that. But it was supposed to be for moms that couldn't get outside of the house because they have, you know, anywhere from 2 to 6 kids and they need these appointments done at home and it's just too hard for them to get a sitter. And so that's why when we started the company, the offerings were offered from 7 a.m. to 10 p.m. because what we saw was the most common appointment time was after you put the kids to bed. And then you got to take care of yourself a little bit. And we would come in and do whatever it was that needed to be taken care of and just make sure that she was okay. And then she would go to bed and start her day the next day. So that was really what the preface was of the company. You know, and like I said, that was why we focus so much on time, is because there's so many of us that don't have enough time. But when you have young children and you have people that rely on you, you definitely don't have time. So
this sounds so amazing.
Thank you.
And it sounds like this, like, you know, the unicorn, right? Mm-hmm. I have to think it didn't just magic wand happen without some learning.
Oh, yeah.
Maybe some obstacles, stumbling blocks along the
definitely.
way.
I mean, I will be the first person to tell you, like I said, we had no roadmap. So we would do things and they wouldn't work. And I was like, okay, let's not do that again. But I think that is probably even more valuable than had I gone and gotten an MBA or some sort of degree, because I learned, and Katie learned, how to run a business in real time. Like, we used the feedback that we received from our clients as ways of changing the company. And that's what we did. And that's what we've inherently done over the last 3 years.
And some people might not seek or run away from feedback. So how did you actively seek feedback, and how did you do that?
So we actively sought feedback, because I feel sometimes people don't want to give you feedback because they're worried it might hurt your feelings.
Especially women, I think.
Exactly. And so we actively sought feedback, and everything that we got feedback-wise, like, it was always, in the beginning of the company, obviously it was Katie and I getting all this feedback and things like that. Things have now obviously changed. But we took that as constructive criticism and evolved and changed to what needed to be done.
Yeah, you mentioned earlier that after somebody gets a service, somebody is calling from your company to
Still to this day, just to make sure that what they envisioned, because remember, we're going into people's homes or we're going into their place of work, and we're providing them a service that they probably haven't had it done like that before. And does it meet what they expected? Is there something that we didn't do that they expected to happen? And so we just have to make sure that the expectations and the reality of what we provide actually meet.
Okay, so wait a minute. Back the bus up.
Yeah.
You just said we go into their place of work.
Uh-huh.
What are you doing going in? What are you providing in their place of work?
So we do a lot of manicures and pedicures at people's, like, corporate offices, actually.
Holy cow.
Yeah. So, like, there, obviously it's not, if it's like some sort of protected meeting or something, then we won't go. But there's quite a few times that someone is in a Zoom meeting and we're doing a pedicure.
That is amazing.
Yeah.
Holy cow.
Yeah. So, and I mean, it's just because, like, they're like, you know what, I'm not going to have time to do this when I get home. The kids are going to be there. Can you just come and do this, like, while I'm at work? Of course we can. We do it all the time. So
I don't think I haven't gone and looked, but I mean, is there anybody else out there doing what you're doing? I can't imagine.
No, there's nobody. Yeah. I mean, there's some companies that provide probably a focus of some sort. Like some companies, I think, do medical aesthetics, and that's all they do. But nothing like us exists. No.
I'm not even sure what next question to ask, because my mind is still processing all of this amazing stuff.
Yeah.
I mean,
so, like, we also have clients that they're on their lunch hour and they want to get a massage because they've had a tough day, and then we go and perform the massage, and then we leave and they go back to work. So
what are some of the errands
that we do?
Yeah.
We do everything. So, like, obviously we have a cleaning component to the company as well. So that is one of our most popular services. And then our house managers are the ones that we have do all the errands. So whether you need something returned, you need grocery shopping done, you need, like, organization through the house, everything, you name it, we do it. So it's supposed to be a way for people to admit that it's okay, you need help. We're not going to judge you. We need help all the time. And that's how we came up with these things, to be honest. Every single service that we added or everything that we provide is something that Katie and I felt we needed. So minus, we do spray tans. I don't need a spray tan. Katie loves spray tans, so that's why we offer spray tans. But, so, like, things like that. But we have sincerely, very much methodically thought out, what will help and what will not help, or what can we do to, like, alleviate people's plates. And so it's definitely a labor of love, and it's been one of the things that I think, you had asked me earlier, like, how do I kind of, like, separate what I do as an ICU physician and what I do in my personal life. And I think, sincerely, the company allows me to do that because it's a way that I express my joy, because I feel that it's a way of giving to people what they can't have.
So I think of, again, women who maybe have a hard time asking for help. As a mom, have a hard time spending time or money on myself, which some 100%. Of that you think of cleaning the house as for the family, but still feels like,
I get it.
I should be cleaning the house. That's so women who may be hesitant to do those things.
Yeah.
Yet probably on the other side of it are like, this is maybe the best thing I've ever done in my entire life.
Correct. Yeah.
Any situations, this is where I'm going for story time here.
Yeah.
Any situations, whether it's like that or something else that stick out to you where somebody's like, I never knew an angel like this existed, or you changed my life forever.
I have so many angel stories, actually. And so we have one of our clients that has been with us for like 3 years. So she actually joined the company more for her family. Like, she wanted the kids to be able to have haircuts at home. She didn't want to have to, take them everywhere. And then what organically happened was that she saw that they're getting their haircuts. Hey, can I get a haircut too? Like, he's already here. Is it okay if I just add myself on? And I'm like, of course, do whatever you need. And then she was like, hey, I want to do like a manicure day for the girls. Can you like do that? And we use actually non-toxic nail polish for kids, and we're very careful about all that stuff. And so, of course, the kids are getting a manicure. And then she's like, you know what? I think I'm going to get a dip done. And I'm like, okay, that's fine. And then like probably 2 weeks after she started like kind of just like adding herself on, actually, instead of scheduling initial appointments for herself, she told me that she felt like it was one of the best blessings that we, came into her life, and she can't believe that this is like all available to her, and things like that. Like, I had a client just yesterday leave me a voicemail, and she was like, you know what? I came home from my trip and I just got here, and my husband's asking who detailed the cars because they're just so beautiful and so clean. And I was like, well, that was Vivia. And just like stories like that. Like, I had sometimes on our social media, we actually do share like those are real time like snippets from clients and things that basically thank us for. And like I said, I know it sounds ridiculous, it sounds small, but we take so much ownership of it, and we try to make sure that the smallest things, what we realize is the smallest things make the biggest difference in people's lives.
Yeah, they really do. That nagging thing that you've been wanting to get to, but all the other things take priority, and then it just... Yeah. Those are the things that, they talk about, the mess that you see on the counter, et cetera, that ends up stressing you out so much that even just that simple thing of getting it done can help.
I always tell people, like, having it's a membership-based company, so you do have to have a membership to use all these services. And the reason we did that was because we wanted to make sure that we're protecting not only our providers, but we're also protecting our clients. Like, you want to make sure that the expectations of what the client has meet what you can deliver. And early in our company, we realized that people's expectations were exponentially higher than what we were providing, and so we had to meet them, you know what I mean? And so now it's you have to have a membership, and then you pay per service, but the service rates are probably lower than what you would pay actually to go get the service done.
So it sounds like some lessons learned along the way. What are some that really stick out to you?
I think the one thing we learned early was that your customer base is your real time. You can tailor a business based off of what they're telling you, as long as you're open to the feedback, and we used real time like feedback that we were receiving to change what needed to be done in the company. And that's probably why our loyalty base for the last 3 years has been so like, it's just like this very steep, like straight incline. And it's just because when we will never tell anybody that, we're 100% perfect, because we're not. And we will tell them that, maybe we've made a mistake here or something like that. Our clients will tell you we don't make mistakes, but that's not true. And so you just have to be honest. I think honesty, sincerely, is a lost thing in this day and age, frankly. And then the other thing we learned is the interaction between someone from the company and the client means so much to the client. So like, I ordered furniture, outdoor furniture, and they were like, the whole order got delayed by like 6 weeks. And now everything's run by AI. And so I could not get a person to call me back. And it's just like, I've already paid them in full, by the way, for this furniture. And I just want to find out, like, are some pieces going to come sooner? Or like, I've already paid you technically. So can I talk to like a real person or have someone call me back? And it takes about 2 to 3 days now, depending upon how big the company is, to have anybody call back or say, we can do this, we can't do this, this is when it's going to happen. Is that really what customers want to pay for? I don't think so.
I'm totally just shaking my head here next to the microphone for those who are just listening and thinking every time you're like in your kitchen just going, representative.
Yeah, representative. Exactly. I mean, I've said representative so much in the last 3 weeks, and I'm like, where's my representative? But should it really take someone 2 days to call you back? I don't think so.
No.
And, I think that when we started the company, that was extremely difficult for Katie and I to do, because we were so busy in our day-to-day lives. And like I said, we had a lot of support, and we have a business manager now and all that stuff. So all that stuff is kind of taken off of our plate. But that foundation of the company has never disappeared, despite how big it's become.
How do you maintain that culture, those values, as the company grows?
So we are extremely careful in our vetting process of anybody we hire. And that's just because it's for protection, like I said, for both sides. You want to make sure that that person meets your values and what you've set forth. And usually Katie and I, so we are still very much actively involved in the like recruitment and interview process, because we can usually tell when someone's going to be a good fit or when it's just not what they're looking for. And so we make sure we outline very clearly what the company values are. And honestly, we've been so lucky in the people that we've met that provide all these services to our clients, that I don't know if it's luck or if it's our ability to really like find people that meet us like where we are. But I would say there's a component of luck to that.
I want to rewind to something you said earlier, that honesty is maybe lost. Tell me more about what you mean there.
I think like in the sense of when people make mistakes, I think inherently human nature is to get defensive and not own the fact that you made a mistake or that you've made an error. And I think it goes a lot further if you're just honest and own your mistake. In this day and age, like when you call somebody and say that I have this problem, what you'll notice is that they'll blame the next person or the person before them or this and that. But it's just easier to just own up to it and, say, you know what, I understand where you're coming from. This actually, we can do this to rectify the situation and go from there.
Yeah, it's, I think about that a lot, because I think from a person who wants to people please and I don't know, that perfectionism, how I was raised, you drill on the mistakes.
Definitely.
And I understand, because it's to be better. However, we never really celebrated the successes.
Yeah.
That it's that fear of that mistake, because does it mean you're bad?
Right. And I think when I inherently think about, as a physician, the thing that I'm taught throughout my whole life is to not to fail, right? Don't fail, because if you fail, then your patients fail. But is failure such a bad thing? Is it, would we have started this company? Well, like I said, we were naive when we started the company, but we were still inherently, like, we feared failure versus, like, it's okay to fail. You'll learn from the mistakes. And we kind of did that, right? We like failed in certain ways, and then we changed things that needed to be changed, and then continued to grow. So failure is not necessarily a bad thing as long as you learn from it. If you take it as a negative and say, you know what, there's nowhere to go from here, then it's going to be more difficult for sure.
And I'm saying this as much as for myself as for everybody else. And that, I guess, if you're not, necessarily failing here and there along the way, you're really not pushing yourself 100%. To the boundaries or beyond.
I totally agree with that. If you had asked me 6 years ago if Katie and I were ever going to start a company together or whatever, and I would have been like, I have no idea what you're talking about. That doesn't sound like anything I would do. But it's okay to push yourself out of your comfort zone and not know what you're doing and make it up as you go.
Says the woman with, the ICU doctor, 2 young kids, and this business, et cetera, et cetera.
Yeah. I'm extremely, like I said, grateful that I have a lot of family support, and I have a nanny that's been with us for probably 4.5 years, and they allow me. I always, our clients make fun of me, but I always say, dysfunction is my function, because that's just how my life is. So you get used to it. Same thing with Katie. Her dysfunction is function. So
I think that is the way sometimes with the kids. It's a day to day, sometimes hour by hour, just
definitely. You just got to take what you get.
Right. So, is everybody alive?
Right.
And where
exactly.
they're roughly supposed to be.
Yeah, exactly.
And if they aren't, we'll live to tackle another day.
Exactly.
So when we think about, so far into now, when you reflect, gosh, that's a lot that you've done. What is it in you? Or, people are probably sitting back going, wow, I feel less than, or I should hit the gas pedal a little bit more. What is it that...
I think I can speak for Katie and I in this both together, because we're both very similar in this regard. We never really compared ourselves to anybody, and I've never really compared myself to anyone. We do things that make us happy. And I think if you're chasing whatever it is that you're chasing in life, just make sure it gives you happiness, because that will show in everything that you do. And I still think that there's more to come from me as a whole. So we'll see.
Is that something that we know already?
No,
twinkle, twinkle,
yet.
or is it?
Well, I know already, but But I think that my story's still being written, if you will. So.
Yeah, and they often say that, many people, many successful people really haven't hit their stride until their 40s or 50s or whichever, because oftentimes that's when we're really starting to understand ourselves and understand what lights us. Luckily some people understand themselves earlier and what gives them joy and what their passion and life should be. 15 and 16, asking to
follow, shadow and ask questions. And I think that there's something to be said about who you are as a person too, right? I think that basically creates your story, if you will, over the next 20, 30 years. But I think that it's always important to remember that the only person limiting you is you. So there should be no limit to anybody's successes. There should be no limit to what you can do. And if you aren't, like you said, being pushed out of your comfort zone, then it just means that you're too comfortable. And is too much comfort mean that you're not really achieving all that you can achieve? It's probably some component of that.
Yeah, something I had read was about choices, right?
Right.
And the choice is in your control. The choice is... if, you're staying in a job that you don't like, where you're limited, well, you have the choice to stay, or you have the choice to look for something else and make a change.
Right.
So what are you choosing? And then, from there, I guess, you stop complaining.
Stop complaining and do it. Yeah, exactly. I mean, you made a choice, so follow through on the choice and see what it brings.
Right. And even just last week, I was meeting with a young woman who I've sort of mentored through the years here and there. And we were talking about whether her current role is where she should stay or should she look elsewhere. And, she had a very good outlook, especially early on in her career with, no kids. I would say not a lot to risk at this point. And she's like, well, I guess, if it doesn't work, I can always come back or look for something else.
Or look for something else. Yeah.
That's exactly the way you should be looking, especially now in this day and age where it's less about working somewhere for 30 years.
Yes.
And it is about adding different skill sets.
Adding different skill sets. Yes, correct.
And, gosh, there are going to be jobs and careers in 3-5 years that aren't even a figment of our imagination right now.
Right.
So there should be moving around and taking that risk. And, maybe you join something for 3 months and the culture isn't what you thought.
Yeah.
The leader isn't what you thought, or the work isn't what you thought, or whatever it might be.
Right.
It's okay to then pivot and look for something else.
Yeah, definitely. And I think I always tell people, like, if they're thinking about doing something, just do it. I mean, any business person you meet, any person that, runs their livelihood basically off of whatever it is that they're doing, will tell you that the more you think about things, you just end up just thinking about it. Just act on it and just, see what happens. So, like I said, the only limit in life is definitely us as individuals.
And it doesn't have to be some grandiose parade action.
Not at all. No.
It could just be that action begets action.
Correct. Exactly.
Take a step.
Exactly. So, and there's nothing wrong with that. There's also nothing wrong with not knowing what's going to happen. There's nothing wrong with the unknown. Obviously I'm biased to that because that is, my life. But like, there's nothing wrong with that. It's okay. And sometimes I think people have to hear that.
In fact, I mean, holding on to thinking we know 3 years from now or 5 years from now will limit what could really come to us that might even be better.
Yeah. Yeah, you're right, 100%. But you'll never know until you try.
So what's next? Is it continuing ICU, kids?
Yeah.
Potentially adding more services? Or
I think we'll probably continue to grow the company. I think people always fundamentally ask me, they obviously don't ask Katie, but like, are you going to keep practicing ICU medicine? Because it's just so different than, this business and stuff. And that ICU makes me who I am. And it's fundamentally very fulfilling for me. So I enjoy taking care of super sick patients. I enjoy getting them to the other side of the spectrum where they're able to get out of the ICU and get home eventually. And I don't think that I could ever lose that part of me because then I would not be who I am, I think. So, but people always are just flabbergasted by that because they're like, really? And I'm like, yeah, I just don't ever foresee myself ever stopping. At least medicine as a whole. So, yeah.
Yeah, I can see that. I love the podcast. I love bringing the women together and the stories.
Right.
But I love financial planning. I love the numbers and the puzzles. And give me a tax return. And
it makes you, right? Like it's just something that like, what would you do if you weren't doing that? You know what I mean? And so
I'll get my 10-key calculator. Yes, I'm old. You get your stethoscope.
Yeah, got it.
And we'll just go.
And we'll just like
we'll get Manny's and Betty's together and have some fun.
Exactly. So I think it's just, I think that, like I said, we have clients ask me that all the time. And I'm like, no plans to really stop that. And like, really? Yeah. So, like I said, I just really enjoy my, my career as a physician. And it's just probably, I see more life and death and probably more than a typical doctor. And so I think that aspect of it kind of just ties it together for me and makes me very grateful for everything I have.
Anything else, advice, thoughts you want to leave with everyone before we get to sort of our closing out, where to find you and the company and the services?
Oh, okay. I think that, like I said, I hope that, people get out of this is that the littlest things in life make the biggest difference, and you don't know what tomorrow's going to hold. And everyone should cherish whatever it is they have, and just be happy. It's easy for me to say that, obviously, but it's the littlest things that can bring that much happiness to people. Like for me, like I said, having my children and my family and things like that, that gives me an immense amount of gratitude. I feel very grateful to have them in my life. And I don't know how I would deal with all the things that I deal with on a daily basis if I didn't have them. But everyone has some aspect of that in their life. And I think sometimes my perception is a little bit different. Obviously, we're here, talking about Vivia and my time as a physician, but I also want people to understand that life is not that complicated. Just enjoy what you have, and it'll all work out.
Yeah, I'm listening to this book, just started this morning, by a friend who recommended it. I think Big Magic, or The Magic.
Yeah.
And literally talks about gratefulness and the energy you have is what you bring in.
Yeah,
and
exactly.
There are things. Yes. It could be as simple as I woke up this morning, or as simple as the sun was shining.
Right.
Or even those days where you need rain.
Yeah, you need rain, exactly. I read this little thing somewhere recently where you're always chasing something. Like if you are a millionaire, then you want to become a billionaire. If you're a billionaire, then you're chasing something else. And I think that we just complicate our lives too much. And I think that the entity as a whole that we should all chase is just happiness, whatever it is that makes you happy. So,
and oftentimes it's already there.
It's already there. You don't even have to find it. To be honest, it's just about looking at it differently. So,
wow. That's a great place to end it. Yeah. And a lot of times I'd say, okay, well, if you want to go find her to work with her, well, we're not going to talk about how to find you in the hospital.
Yeah, don't. Exactly. If you need me, I'll be there. So.
Right. You don't have to go find her, search for her. So
correct.
We'll leave that alone.
Yes.
She's a doctor. She does amazing things in that regard.
Yeah.
But what are the best ways? Because amazing to go find all the services.
Yeah.
And
so our website is www.viviaconcierge.com. If anybody goes on the website, they can see all the service offerings that we have. I will let everyone know that we are actually on a wait list right now. So our individual services, or our individual like Lux Family and Premier memberships are currently at like its peak. So we'll be opening up a couple of more slots probably in about November, but we do have a wait list.
And so, Vivia spelled?
Vivia.
That's what I thought.
Yeah.
Well, thank you for reaching out to us to share your story. Yeah. So amazing, covering such a time period and so many things in there. And wow, just amazed by everything you're doing and the heart and the spirit underneath it all.
Oh, thank you so much. That's so sweet.
No, I mean, it's there. I just sit in a chair and you share it all. So, and then of course the husband does all the magic behind the scenes. So I can't forget him. So thank you for coming today.
Of course. Thank you for having me. So I really appreciate it. Like I said, I think that I've just enjoyed talking to you. So
it's been a blast, and I can't wait for everybody to hear.
Yeah. Thank you.
This concludes another episode of the Shelift Project podcast. To hear more episodes of the show, subscribe wherever you get your podcasts. And to learn more about our mission of helping women reach higher levels of success, visit sheliftproject.com and sign up to receive the latest news, ebooks, videos, and more.